We are seeing an increase in the coronavirus case counts in the past couple of days. Here are the numbers. Since this time yesterday, we've identified 166 new cases in Philadelphia residents, bringing us to a total of 34,310 since the beginning of the epidemic. Now, this is the second day in a row which we've seen high case counts. Yesterday, we identified 235 new cases. Some of those are people who were tested last week and are just now being identified as Philadelphia residents. And so last week, the week that ended on August 28th, we're now up to an average of 108 cases per day. On Tuesday, I said that we were around in the 90s per day, so we've gone above 100. And the percent positive last week was now 4.1%. This increase we've seen over the past few days has predominantly been in younger people. Today, 31% of the new cases are ages 20 to 29, and 25% are ages 10 to 19, most of those probably in the high teenage age range. We don't have a complete accounting of the cases that are associated with the outbreak at Temple University because students may not report or their Philadelphia addresses. They may report their address where their parents live, in which case we don't get the report here as a Philadelphia resident. And if students are tested at community sites, those community sites may not know that they're Temple students, so that information may not go to Temple. However, it does appear that most of the increase in the past week that we've seen across the city is related to the outbreak at Temple University. Now, this is occurring in the context where there's a rise in cases in the state of Pennsylvania as a whole, and rises we've seen in many other states across the country. Much of these appear to be linked to college outbreaks. Since this time yesterday, we've identified one new death of the coronavirus infection in a Philadelphia resident. The total is now 1,759 for deaths since the beginning of the epidemic. A quick update on contact tracing. For the contact tracing we did last week, we were able to reach and have agreed to participate 60% of the cases that we managed. 8% had no telephone, 24% we've been unable to reach, so we still have a problem with a number of people who were not picking up the phone, and 3% talked to us but refused to participate. Of the contacts that we had named for us, 77% were reached and they agreed to participate. Now let me talk a little bit more about the situation at Temple. Our contact tracing continues to show that the cases were predominantly among students who lived off campus. And the spread was occurring amongst roommates, often in crowded apartment buildings, and in social gatherings, typically small social gatherings. And we continue to work closely with Temple University to contain that outbreak with expanded testing and with contact tracing. I remind people that in the short term, our guidance to Temple students is to be very careful, just to work under the assumption that everyone around you is infected because many people have this infection and show no symptoms, and that you should stay in your room or your apartment unless you have to go out for an essential errand. And when you're around anyone else, wear a mask. Now, over the longer term, as you heard this morning and you heard the mayor just talk about, Temple has announced that it will shift almost all of its classes online for the remainder of the semester. That will enable students to take classes from anywhere. And Temple is offering a refund for room and board for students who are living in the dormitories to enable students who want to vacate student housing. But Temple will maintain the quarantine and isolation space on campus. Now, we are today encouraging students who live off campus in these crowded apartments, if they can, to move back to where they lived over the summer, to reduce the density there, to reduce the risk there. This will reduce the risk to those students as well as to others across the city. We recommend that students do that, however, carefully to avoid bringing the infection back to their family members. Health department will be working with Temple on guidance to students as to what's the best way to do that. In the meantime, testing is available through Temple University, or any student, like anyone else, can go to our website, www.phila.gov/testing, and access any of the testing sites that are listed there. As the mayor did, though, I want to go out of my way to really thank Temple for working so closely with the health department leading up to the start of the semester and as well during the response to this outbreak. Temple did everything we asked them to do in advance, and they were very successful in preventing spread in classrooms, in dormitories, and in cafeterias, all the things that happen on campus. What occurred here really was the things were very much out of their control and students living off campus. The Temple did, however, call us last week when they first noticed an increase in cases. They worked closely with us over the weekend during this week to try to contain this. This is simply not an easy problem to fix. I do think that the plan that the university's put together is the wisest plan to respond over the longer term. I also want to remind people, as the mayor did, that Temple stepped up to help the city in April by lending the Leah Core Center for our surge facility, which was absolutely necessary at that time. So we appreciate that, as well as we appreciate how quickly they responded to this stage as well. So that's the situation at Temple. Overall, we have not changed our plans to allow indoor dining in theaters to reopen with restrictions next Tuesday, September 8th. In the big picture, the college-associated outbreaks, though, do show that virus still has the potential to come back strong. And I continue to get many requests to allow additional activities to restart. And I know it's difficult for people to maintain these safety precautions, especially after so many months. But we need to continue to limit how we get together to avoid more cases. And although most people recover fine, just remind people that some people get very seriously ill and some infections can be fatal. So even for those of you who are young and are likely to recover well, you may pass the infection on to others, so you don't want to get that infection and pass it on to somebody who may be medically vulnerable. Our recommendations to everyone citywide is to avoid social gatherings, including small gatherings with relatives or friends, the sort of people you see every day that you may trust. Avoid those gatherings. That's how the predominant mechanism for this virus to spread right now. And when you need to be around others, make sure you wear a mask, including a mask when you're around relatives and friends. This is especially important for people over the age of 65, or people with medical conditions, or anyone near those who are over 65 with medical conditions. That's the status report for today. If you want more information, go to our website, www.phila.gov/COVID. Thanks.
Hi, I have two questions for Dr. Farley. My first is, Dr. Farley, do you think that Center City Restaurant Week is a good idea so close with the rollout of indoor dining?
I'm not familiar with the details of Center City Restaurant Week. I would simply say that we have a lot of safety precautions built into the indoor dining rules, and that if all the restaurants follow them, the risk should be low.
My question is about the COVID-19 vaccine. We're getting some information that the CDC is telling Philadelphia and other places to prepare for a potential vaccine as early as early November. And I wanted to ask Dr. Farley, are you comfortable with the process so far? And do you have any concerns about how it's being handled or the speed of it?
What we've been asked by the CDC is to assume that a vaccine is available. And if that were the case, how would we distribute the vaccine to people who are at high risk or who are designated as high priority? And I don't think that that's inappropriate at all. I think that's appropriate for us to develop those plans. Sooner or later, we're going to have to disseminate a vaccine. I think the deeper question is, will there be vaccine that is approved that we are confident is safe? And we don't know that yet. We don't know what vaccine they're talking about for sure. And we haven't seen any data about the safety or effectiveness of these vaccines. And so we'll have to address that question closer when we hear if there's any vaccine licensed for distribution.
And how will that work? Once the CDC says, okay, this vaccine is okay, whether they're saying it's gone through the phase 3 trials or they're saying we're using an emergency use authorization for it, will the city just distribute it, or will you first make a determination of whether you think it's safe?
With any medicine or any medical intervention, there's always a balance of the risk versus the potential protection or the value of that. And so the question may less be, is this vaccine safe for everybody, rather than for what populations might this vaccine be appropriate? And I can't predict what that would be now. I simply say that we will evaluate the data available to us when and if a vaccine is licensed for use in Philadelphia, and make our recommendations to people based upon the evaluation we have at that time.
Just a quick follow-up on that. Do you feel that a vaccine has to go through those phase 3 trials and complete them, or would you be okay with an emergency use authorization from the CDC?
So if we're talking about the general population, everybody, I would want to see phase 3 trials and proof of safety and efficacy before we recommend the vaccine. That doesn't mean, though, that there might be some populations for whom a vaccine is appropriate, even if we're before the phase 3 trials, the people who are at extraordinarily high risk, and if the earlier trials do suggest safety.
I had another question for Dr. Farley. Dr. Farley, you had said that most of the cases at Temple University appear to be coming from off-campus residents, but Temple, the dashboard that they have lists that 211 of those cases are on campus and only one of them is off campus. So do you know why there's that discrepancy?
I do, because I asked about that earlier. that classification on their website is based upon whether a student has ever swiped into any on-campus site at all. And so students who live off campus, they come on campus for classes or other activities. And so they're classified as on campus in that statistic, but they're residing off campus, and that's where the spread is occurring.
Okay, thank you.
All right, thank you, Layla. Let's go now to Sean Walsh of the Inquirer.
Thanks very much. Dr. Farley, just following up on the questions about the vaccine, are you worried that there might be corner cutting at the federal level for political purposes, given that they're specifically talking about Election Day as the time when it might be available by?
I am concerned about that. And all I can say is that I will evaluate the data that's available when and if a vaccine is authorized for use and make the recommendations based upon my assessment and speaking to experts around the country as well.
Thanks. Hi, Mike. Nice to hear you back on the call. Wanted to start with Dr. Farley and the CDC vaccination guidance. I know you guys are just considering planning for right now, but in that case, like, have you guys had some initial thoughts about distribution, where it would occur, where it might occur? Would that be a city thing? Might you use Leocora Center again? Those thoughts initially.
As I said before, I mean, it'll depend on what would be the high priority populations that we are recommending the vaccine for. But we have experience in distributing vaccines in other ways, and it would probably be through a combination of sites, such as hospitals and federally qualified health centers, and maybe some new clinics are set up, maybe some doctors' offices, to give people, so we reach people who are high priority and give them a few options.
Hi there. I just wanted to clarify on the Temple. What role did the city play in Temple going to all online classes? Was there pressure from the city to do this? And again, just, your reaction on their decision to do so.
Let me start first. There was no pressure from the city. When we deal with our partners, it's information sharing, it's data sharing, and the institution itself makes a decision based on the information we're giving them. So the term pressure on Temple is not accurate, and it's was done mutually understanding the information, and they made the right decision. Doc?
I was going to say the same thing. We work closely through
Get smarter, Doc.
Again, from the summer right through this outbreak and all this discussion through this of what the appropriate response. So not pressure, it came through a decision for Temple. We do think it's the wisest move at this point.
Dr. Farley, he has emailed his question to you, so I'm going to read it. He says, Governor Wolf announced yesterday new guidance for sports in Pennsylvania. Attendance for outdoor activities is 250 or less, and indoors is 25 or less. And David was looking for your thoughts on that revised guidance.
So across the state, the limit for outdoor events of any type is 250, but here in Philadelphia, we've kept it at 50. Concerned about larger size events than that. The only change is that the spectators were specifically prohibited at sports events across the rest of the state, even though people could gather in other settings, but not be a spectator at a sports event. It's a fairly small change across the rest of the state, and it wouldn't be consistent with what our current restriction here is of 50 people total for a limit of an outdoor gathering.